Okay, so I'm going to go over how to prepare and administer subcutaneous and intramuscular injections. I will be injecting heparin subcutaneously and Halidol intramuscularly. So to begin, you want to confirm that your orders are correct and appropriate for your MAR and that they're going to match your MAR correctly. So going through the 8 rights, you're going to look at the MAR for the right patient. So in this case scenario, it's Mary Martincini is the name on the order. I'm going to look at the medication label, and I'm going to ensure it's the right medication, right dose, and right route was pulled. So in this case, Mary Mancini dictates to give 5,000 units of heparin subcutaneously every 12 hours and to give 1 milligram of Halidol intramuscularly every 4 hours as per needed. These injections get injected into the abdomen, the outer aspect of your arm, and the interior aspects of your thighs. But today I will be administering the subcutaneous injection into the abdomen. The IM injection can be administered into the vastus lateralis, the dorsal gluteal, and also into the deltoid. Today I'll be administering it into the deltoid. So I'm going to check the expiry date on the medication as well to ensure it's not expired. I want to check that Mr. Mancini is getting these medications for the right reasons. So Mr. Mancini's receiving anticoagulant and antipsychotic medications to treat and prevent blood clots, as he's mostly bedridden right now, and it's used to treat mood disorders such as schizophrenia. Okay, so I'm going to check that Mr. Mancini is receiving these medications at the right time. I am giving both medications at 8 o'clock, which is correct. I'm going to check if Mr. Mancini has any allergies. So Mr. Mancini does have allergies to codeine, so you just want to make sure that this medication doesn't contain any codeine because it could give him anaphylaxis. So bleeding, bruising, cyanosis, drowsiness, rash, difficulty urination, those are some examples of side effects that the medications given to Mr. Mancini can have. So I just need to be aware of those side effects because they might occur on the patient. So after administering the medication to the patient, I do want to check that I have completed the right documentation. For subcutaneous injections, I'll be using a 1 to 3 milliliter syringe. So I want to choose a 1 milliliter syringe just because it's the most accurate syringe to measure the 5,000 units of heparin. The appropriate gauges are 25 to 27. The appropriate length of the needle varies from 3/8 to 5/8. And the needle is shorter for subcutaneous injections because you want to penetrate the adipose tissue layer. It's like the fat layer underneath the skin. For intramuscular injections, I'll be using a 2 to 3 milliliter syringe. So I chose a 1 milliliter vial because it's the most appropriate to give the 1 milligram of Halidol. The appropriate gauges are 20 to 25, and the appropriate length of the needle varies from 1 inch to 1.5 inches. So the needle is longer because you have to go through the skin, the adipose layer, and then to get to the muscle. So if you have a bigger patient, you're gonna need a bigger needle, and if you have a thicker medication, you would want a bigger gauge. Okay, so I'm just gonna perform some hand hygiene before I draw up the medication. I'm going to take an alcohol swab, and with it, I'm going to put the vial, ensure it's the right medication, and the right dosage on here. Because some heparins can have a higher dosage. And then you want to clean the top of the vial with the alcohol swab. Dispose of it properly. Okay, so after alcohol swabbing the top of the vial, you want to grab your needle from the packaging. Usually this one already came assembled. If it didn't, you would have to assemble it with the correct gauge, needle length, and then when I'm injecting, I want to make sure I'm using a blunt needle, and then you can change the needle tip out later. So when you're taking off this cover that protects the needle, you want to pull it out away from you so you don't injure yourself. I'm just going to stick this cover on the table so I can recap it after. I'm going to make sure my vial is sitting on a flat surface, and before I inject the needle into the vial, I just want to make sure that I draw up the correct amount of air so there's negative air pressure in the syringe. So I'm going to draw it up to 1
milliliter.
Okay, so now that I have the air drawn up into the syringe, I'm going to inject it into the vial. Okay, you're going to want to inject the air into the vial for the pressure. Flip the vial upside down, and then you're going to draw back until you get the desired dose. Sorry it's taking so long.
It's okay.
Just want to make sure there's no air bubbles in here. Okay. So now I'm going to set the syringe back down, pull it out. And if you see any air bubbles in your syringe, you just kind of want to flick them to the top. And then pull back on the plunger slightly, and then expel the air out of the top of the syringe. Okay, so I will be administering 0.5 milliliters of Haldol. So to do that, I just want to again pull back the air, so 0.5. I'm going to make sure my vial's on the flat surface, hold it, inject it into the vial. Going to insert the air into the vial, tip it upside down, and withdraw the medication. Okay, again, flick any air bubbles that you have out to the top. Pull back the plunger a little bit and expel the air out of the syringe. Okay. Again, I'm going to put a safety sheath on this while I'm like walking to the patient's room to administer the medication. Once you compare the medications with your MAR, you're going to write down and label your medication, and you're going to want to label it on the MAR after. And then you're going to want to dispose of any of your supplies in appropriate receptacles. So I would just throw any extra things out I don't need. Okay, so now that I have all my syringes filled up, I'm going to check my MAR once again before I go to the patient to administer the medication. So what you want to check again is that you want to check that you have the correct medication. So you want heparin and Haldol. That's correct. You want to ensure that you're giving the right amount. So you want to give 1 milliliter of heparin. You want to give 0.5 milliliters of Haldol. You want to make sure that you're using the correct syringes. Okay. So I'm just going to perform hand hygiene before I inject Mr. Mancini with the medication. Gonna make sure I put on gloves. So this is not a sterile procedure. You just need regular gloves. So I'm going to confirm my patient identification and explain my procedure to my patient. So, hi Mr. Mancini, my name is Megan. I'm a level 2 nursing student at Conestoga College, and today I'll be giving you 2 injections. One will be heparin, which will be given subcutaneously, and one will be Haldol, which is administered intramuscularly. So you're requiring these medications because you're bedridden a lot, so the heparin will prevent your any blood clots or deep vein thrombosis, and your Haldol will just decrease any symptoms of the schizophrenia you may be experiencing. Okay. So Mr. Mancini, now that I've confirmed your name and date of birth, I'm going to go ahead and proceed with the first injection being subcutaneous. So when you're doing a subcutaneous injection, you want, especially in the abdominal area, you do want to ensure that you are doing at least 2 centimeters away from the umbilicus. So you want to go in anywhere in this area. But first, before you administer the medication, you do want to ask Mr. Mancini, what was this area that your last subcutaneous injection was given? Just because you want to avoid that area and just go to a different spot that hasn't been injected yet. So Mr. Mancini indicated that he hasn't been injected on the left side yet. The last side was on the right. So I'm going to go ahead and administer the medication. Okay, so before I inject Mr. Mancini with the medication, I'm just going to ensure I get an alcohol swab, and we're going to pretend that I opened it, and we're just going to swab the area to make sure it is clean. Before I inject the medication, I'm also just going to let the area dry for about 15 to 20 seconds. Okay, so now that I've identified the area that I'm going to be injecting, I can't inject into the mannequin, unfortunately, so I'm going to use this. I'm going to landmark 2 inches away from the umbilicus. Just going to set my pad here. Since it's heparin, you want to ensure that you squeeze the skin. And when you're giving this subcutaneous injection, you do want to make sure that you're inserting the needle at a 45-degree angle. Okay, so Mr. Mancini, I'm preparing to insert the needle. You're going to feel a slight pinch. So you can take a deep breath in 3, 2, 1. And I'm just going to administer the medication. Okay, and because we're administering heparin, you do want to make sure that when you withdraw the needle, you do keep the skin pinched. Okay, so after administering the medication, if you do not have like the protective cap for the sheath, you can recap your medication. So the appropriate technique to recap your medication is have the top lying on the counter. You want to come with the needle facing away from you and scoop up the needle like this. And you want to get a fine hard surface and just press the needle closed. Okay, so Mr. Mancini, I am going to prepare to administer your intramuscular injection of Halidol, and I'm going to administer it into your deltoid. So I'm unable to show you on the mannequin where that is, but you want to find the acromion process of your shoulder, and you want to go 3 centimeters down, so you want to administer in this location of the arm. So I'll be demonstrating on this today. Okay, so before administering medication again, I just want to make sure I get an alcohol swab. We're going to pretend that I'm opening it right now, and you're going to swab the area of the skin where we're injecting it onto the deltoid. Let it dry for 15 to 20 seconds. Okay, Mr. Mancini, I'm preparing to inject the medication into you. You're going to feel a slight pinch in 3, 2, 1. Before I inject the medication, I just want to draw back on the needle to make sure I don't see any blood, to make sure I'm in the right area. I don't see any blood, so I'm going to go through and inject the medication into the patient. Going to draw it. Okay, so again, after administering medication to Mr. Mancini, you just want to ensure that there's no needle stick injuries after when you're disposing of it. So again, you're just going to recap your needle on a flat surface. And then on a steady surface, we're going to push the needle back in and dispose of it in the Schweppes container. Okay, so once you have finished injecting your medication, you do want to document properly. So you want to go back to your MAR, you want to circle the correct time that you did administer the medication, make sure you initial, and that is how you document properly. You want to return back to your patient in around 15 minutes to half an hour, and that's just to make sure that there's no adverse effects going on with the medication. So you don't want to see any fever, redness, swelling, heat around like the site of the injection. You do want to make sure that after injecting, you do want to apply pressure to the site that you injected and just put gauze and a band-aid over to prevent like infection at the site just by covering it, and 2, just so it doesn't bleed.